Senator Murray.
Thank you very much. Welcome, Dr. Bertagnolli. Really nice to see you, and thank you so much for your willingness to take on this position at a really critical time, because as you know, NIH has an absolutely critical mission supporting medical research and making groundbreaking discoveries that really help everyone stay healthy and keep our nation competitive and give patients hope for the future. So really appreciate your being here and your willingness to go through this process and lead this agency. The agency also does really critical work in coordination with a lot of other agencies to protect public health and prepare for our nation for pandemics and a lot more. So again, thank you. Let me start by asking you, I know at the National Cancer Institute you've done a lot to address cancer-related disparities for women. So in that vein, I wanted to ask you today, across NIH programs and initiatives, do you plan to strengthen research to specifically improve women's health inequities, including women's midlife health outcomes?
Thank you for that question, Senator. It is very clear that there are many health issues in women that are understudied, that really lack knowledge and deserve to have a spotlight shine on them and renewed efforts to be able to provide data to support women's health. I can give you a couple of examples that are really top of mind for me. We have a maternal health, I think it's fair to say, crisis. We had 750 women die either during childbirth or for 1 year after childbirth in 2019. In 2021, it was 1,200. Why? We have to understand that. That's kind of an immediate need that rises to the top. But there are many other things. The whole life cycle of women's health, from childhood all the way through senior adulthood, and that we know women are different. They react to diseases different, and we know that we lack the data to know how to best care for them. So you raise a commitment that something I can easily commit to and say it's very important to me.
Good, thank you. And I'm working with a number of other women senators on some midlife health outcomes. I'll follow up with you on that. I think that's really critical that we look at as well. But let me focus on something you just said, and that's the maternal health crisis. That's something I've spent a lot of time on. It's a huge issue facing women, as you just mentioned, especially since the Dobbs decision. And I wanted to ask you, what can NIH do to improve maternal health outcomes? Specifically, talk about that for especially Black and Native American women who face some of the highest mortality, maternal mortality rates in our nation. Can you talk a little bit more about that?
Yes, thank you very much. So I think this raises the issue. It's a twofold issue. It's an issue of understanding how to care for women during the time of childbirth and immediately afterward to make sure that their health is optimal, but it also raises an issue of disparities in access to care and in engaging with people as physicians and caregivers, being able to listen to them, to understand them, and to relate to them. So I think that the maternal health crisis raises not only important biological and medical care issues, it raises really important social issues. We need to understand people and their social makeup if we're going to help them best.
Okay, great. And we'll work with following up on that as well. But let me ask you about the fentanyl crisis and the opioid epidemic. Communities are really, as you know, hit hard by that. The Lummi Nation lost 5 members of their tribe to fentanyl overdoses in just 1 week, and King County has seen a record number of fentanyl overdoses deaths this year. So I wanted to ask you, if confirmed, how will you work to support research that addresses inequities in access to quality mental health care and treatment for substance use disorders through NIH programs, and support those underserved communities that are really harmed by the national mental health crisis and the rising rate of opioid overdose deaths?
Yes, thank you very much for your championing this issue. I myself have lost patients to the opioid crisis. So I've seen what it does. Absolutely devastating tragedy for our communities, and it has increased so much over the last years, and disproportionately affects certain communities, although really is spread across the entire spectrum of our nation. I can commit to working with you and on continuing the great awareness that the NIDA has for understanding this issue deeply in ways that bring solutions to the people who need it. Like many things, it has to do with not only medical care and understanding better treatment, it deeply has to do with getting that treatment to the people who need it.
Thank you. Thank you very much, Mr. Chairman.
Thank you. Senator